Thank you to the Wolfeboro Lions Club for underwriting Nutritional Wisdom. The Wolfeboro Lions Club is committed to helping the community with health concerns such as diabetes prevention and preservation of sight and hearing. The Wolfeboro Lions Club meets on the second and fourth Tuesday of the month in the 1812 room at the Wolfeboro Inn. Members of the community are encouraged to attend meetings or visit the website e-clubhouse.org/sites/Wolfeboro for more information.
Hi, this is Patty Walker, registered dietitian and certified diabetes educator, and your host of Nutritional Wisdom. Today will be the fourth in an interactive series of diabetes classes. I'll be using materials from the Diabetes Conversation Maps, which are the same that are used in many certified diabetes programs. My goal is to provide you with the necessary information that you need to manage the diabetes from the comfort of your home. Since these classes work best with interaction, I will have some people from the community to be a part of the series, and today I am very happy to welcome Dawn, a person with type 2 diabetes. Welcome, Dawn.
Hi, it's great to be here, Patty.
Oh, well, we certainly appreciate you being here and volunteering. It's going to be a lot of fun. So for today's show, I would like to talk about blood sugar testing. But before we jump into the exact topic, let's take a look at the conversation map that we're going to be using for today's class. Do you see anything about it that looks of interest?
Well, my first interest, looking at the map, is knowing your A1C, because that's what, as a diabetic for probably 7 years,
Yeah.
That's where I rely on knowing what my A1C is.
Yeah, it's a very, very important test, and we actually don't really cover much about the A1C in this episode, but in the next two episodes we do definitely talk about the A1C more in depth, and it's a great test to have a good reflection of what your blood sugar control is. So that's great. And anything else of interest there? The map down here.
Well, I think the combination of everything in the map is really what makes this important, because if you don't pay attention to one part of it, then you're losing out.
Wow, I like that. He's good. All right, great observations. So the image of this, and in the next couple shows, we're going to be using this map, is the hot air balloon. And just like blood sugar control, it's really best to avoid going too high or too low. If you look at the too high, the highs are crashing into the mountain, and the too lows, the hot air balloon is deflated on the side of the water. So what you really want is a nice steady flight. So let's begin by focusing on the orange hot air balloon, which is located on the upper left of the map. And we're going to do a quick review of what blood glucose actually is. So Dawn, could you read what the definition of that is on the orange balloon?
Blood glucose is the amount of glucose or sugar in the blood. Glucose is used as a fuel. Glucose comes from many foods. Your liver also produces it.
That's great. Does that make sense? How does that sound to you?
It's very interesting, because before I started working with you, I didn't know that the liver made glucose.
Yeah, that's a big part of it. And I do like that it reminds us that glucose can come from our liver. Our liver is very insulin resistant, and so one of the roles of the liver is to break down stored glycogen into glucose at times that our blood sugars might be low. But in persons with type 2 diabetes, the liver tends to do that 24/7 and can actually contribute up to 25% of the elevation in blood sugar. That really could be just from the liver breaking down as glycogen and converting it to glucose. So why is it important to manage our blood sugars, Dawn?
Well, because if you don't, they can go out of control, and it can be an emergency situation.
Yeah.
And I've never had low blood sugar.
You're lucky.
But I know that is totally disastrous.
Yeah.
And so, yes, you have to, no matter what you're doing, you have to be aware of your personal situation.
Yeah, and high blood sugars left unattended could cause long-term complications, which will be another episode that we'll focus on what those are and definitely how to prevent them. Yeah. Okay. So, yeah, that's right. In addition, people with diabetes can find it difficult to manage their blood sugars because they don't produce enough of a certain hormone. Do you know what that hormone is?
Well, would that be insulin?
It would be. It would be. Very good. Yes, indeed. So if you have diabetes, then you aren't producing the same amount of insulin as persons that don't have diabetes. So people with type 1 diabetes actually don't produce insulin at all. It's an autoimmune condition. Their body, the cells that make the insulin are destroyed. People with type 2 diabetes produce less. And what's interesting, it's estimated that most people with type 2 diabetes have already lost half of their ability to produce insulin at the time of diagnosis. And that's really if the diagnosis is caught pretty early on, because some people, about 10% of people with diabetes don't know they have it. And so they could be having it for years, and then suddenly the doctor tells them, well, if they've had it for years, they may actually have less than 50% insulin producing capacity. And then depending on control, people with type 2 diabetes can gradually lose production of insulin, and this is, you know, sometimes called the natural course of diabetes, but I like to really focus on lifestyle habits that can really make a difference to prevent that dwindling. And I think you might be able to share a story with us in a couple minutes about how you actually you have some great blood sugar numbers and why you're using your A1C instead of your blood sugars.
Right.
Yeah. So, but knowing what your blood sugars are important, because people in the pre-diabetic range actually start losing insulin production. You know, it goes from 100% down to 50% in that pre-diabetic range. And right now, there are over 80 million Americans that are estimated to have prediabetes, and that's 1 in 3 adults. 1 in 3 adults have prediabetes. 10% know they have it. So I know that's a topic that's kind of near and dear to you. So would you mind sharing your story about how you got diagnosed with diabetes?
Well, this is very important. I'm so happy to be able to talk about this because I was caught by surprise, I would say, finding out that I was a diabetic. For years, doctors had said to me and other professionals, well, you know you're pre-diabetic. And it seemed like it was the end of the conversation.
Yeah, it's like, okay.
Not the beginning.
Ah. That's a great point.
So finally, on a Friday afternoon, I get a call from a nurse, and she says, the doctor wants to see you immediately. And she says, you're a diabetic. And I'm thinking, me? I'm skinny.
Yeah.
I don't have any of the particular signs of being a diabetic.
Right.
And so based upon that, I went in and saw the doctor, but he also suggested that I take this course that Patty has given for quite a while.
Yeah.
And it got me to realizing what I could do proactively.
Right.
And that meant, even though I was skinny, I had a nice belly. And so I started exercising extensively and changed my diet, had carrots and celery and everything around whenever I wanted a snack.
And I remember you chewed your sugar-free gum.
Yes, right. And chewing gum and drinking water and all these things. So
you adjusted your diet and you increased your activity, and those are two of the hallmarks of controlling diabetes. And
right. And one of the things that you had taught me, I think it was you, that in order to get the most out of your exercises, you have to exercise for 10 minutes or more. And I had been sort of doing things at 5-minute lengths, and
Yep.
so I just immediately doubled that. That wasn't difficult, but I didn't have any clue that it would be significant.
It's the physiological effect of how sugar is taken into the cells.
Right.
I actually now encourage my clients 15 minutes, hoping that they do 10. Shh. But
Well, I did 15 minutes this morning.
Good. It's an estimate of between 10 and 15 minutes to allow the sugar to get into the cells, because those muscle cells do want sugar when you're doing activity, but it does take it takes between the 10 and the 15 minutes for the cells to be able to allow the sugar in without insulin, because if you have diabetes or prediabetes, you may not have enough insulin to escort the sugar into the cells, but the cells have the ability to accept it after 10 to 15 minutes
So
of insulin.
education is just so important.
Yeah.
Because we're totally naive about, we think diabetics are old people.
So, yeah, I mean, it's typical to have type 2 diabetes be diagnosed as we age. 50% of people over age 60 either have prediabetes or diabetes. So, I mean, we do produce less insulin as we age. But the largest segment of the population that's now diagnosed with diabetes, percentage-wise, I'm not saying it's the largest percentage of people with diabetes, but of people that are now being diagnosed are teenagers, because they're unfortunately they have the lifestyles that have less activity. Their diet may not be optimal, so we're seeing a higher percentage of diagnosis in teenage years. And it used to be that diabetes was adult onset or juvenile, and now it's type 1 and type 2, because we've changed the titles to adapt to what's going on in society. Yeah.
It's interesting.
It is. But now, if you had to go back and if you could wave your magic wand when the doctors said you had prediabetes, what would you wish had happened?
Well, that they would either refer me to people like you who could help me, but also explaining that if you have prediabetes and you do nothing about it, you're going to become a diabetic.
1 in 3.
Right.
So it's not 100%, but the majority. And then as you age, that's another increased risk
Right.
factor. So
And
yeah.
then once you are a diabetic, it's very difficult to reverse it.
That is
So
true.
I think that the pre-diabetic period is the time when doctors and medical professionals should be really scaring us.
Well, what I like about that is that you can use the A1C test to diagnose prediabetes, and because a lot of people don't do fasting blood work anymore, and so without fasting blood work, we don't have that fasting blood sugar, which, by the way, is the last lab that elevates if you have prediabetes. It's actually the blood sugars after a meal that elevate first, and that A1C test will actually give us a quicker indication, and you don't have to fast for it. So the A1C test is a great test that anyone over the age of 45 should be having. Minimal every 3 years, but annually if you have other risk factors for diabetes, just so that we can get on top of it early.
Right.
So yeah, I agree, because prediabetes can be reversible, and that's
Yes.
the very, very important message that we need to get out there. And I know the Lions Club is trying to help identify people with prediabetes so that they can have a chance to avoid diabetes entirely. So in 2020, look for more free blood sugar testing that will be offered by the Lions Club, and
that's good.
that will be, it's not that it's going to diagnose you, but it's going to give you a number that you can refer back to your PCP with. Okay, so great, thank you. That was a
Okay.
great discussion. All right, now that we've reviewed what blood glucose and insulin are, let's focus on the purple balloon on the upper left of the map that's entitled Blood Glucose Targets. So, what I'm going to ask you to do is to just read what it says on that purple balloon. I know the print can be a little small, but it says,
Blood glucose targets. Fasting blood glucose before meals, 70 to 130. 2 hours after the start of a meal, less than 180. In fine print, it also says individual targets may vary. Consult your healthcare team.
Right. So that's great. Thank you. These goals are from the American Diabetes Association. The American Academy of Clinical Endocrinologists actually have different blood sugar targets. They're going to recommend 70 to 110 fasting and before meals, and 70 to 140 2 hours after the start of a meal. The most important thing is that you know your target. So Dawn, you alluded that you like the A1C, so are you testing your blood sugars now?
No, I am not.
Well, to me that's kind of exciting, but I always encourage people with diabetes to spot check at least once or twice a month. But you're using your A1C as, an evaluation of your blood sugers.
And because I am a diabetic and Medicare recipient, they tell you to have your blood sugar or your A1Cs done quarterly.
Yep.
So I know every 3 months how I've been doing, and if there is an issue, then I would start doing the blood sugars again.
Yep.
As well as all of these things that I've been doing appear to be simple. But to keep on doing them for the rest of your life is not so easy. So I might not cut up my vegetables to have as snacks.
Yep.
And so if I get a higher A1C, I'm saying I better get back.
It's a reminder.
Yes.
It's a good reminder. Yep. And that's where I think the spot checks are a good reminder. But just once or twice a month, just to do it. But so we're going to be talking about an A1C in future episodes. But just to give the audience a reference. A1C above 6.5 is considered diabetes, and A1Cs above 7% is where long-term complications happen. So where are your A1Cs running these days?
These days it's 5.8 to about 6.1.
Wow, that's tremendous.
Yes.
Congratulations.
I'm very proud of that.
That's awesome. So do you remember when you were testing your blood sugars, what numbers you were looking for?
Well, I would say 110 to 130 in that range.
Yep, those are great numbers, yeah.
And getting below 100 is
bonus.
golden.
Yeah, exactly. All right. So when choosing targets, it's really important to consider what you're willing and able to do. Understanding what barriers you might face, as well as how to use the information. So what barriers do you right now you're doing your A1C, but actually you do have a barrier, because do you have a meter right now?
No, I don't.
Not having a meter is a barrier.
I can't really test my blood sugar.
You left it in Florida, ladies and
Yes.
gentlemen. Okay. But what are the typical barriers that people face when the thought of testing blood sugars?
Well, just pricking your hand all
Yeah.
the time is
It's not fun.
what people want to do.
No.
And I think that we tend to, if we don't. When I was diagnosed with diabetes, there was no outward indications that I could see at all. So if you can't see it, it's hard to believe it.
Right.
Say, well, they said I was pre-diabetic or diabetic, but who knows?
Right. Yeah. No, actually, I've had some clients say, well, the doctor told me I was pre-diabetic and stopped eating donuts.
Yes.
So he switched to bagels, which actually had more carbohydrates and impacted his sugars more than the donut would have. Not that I'm promoting donuts, but getting education in that pre-diabetic thing is important. But yes, so barriers to testing could include not having a meter, not knowing how to use your meter, testing, how to test. It could be painful. The cost of materials are a barrier to some people. If you don't have insurance, some of those name brand strips are over $1 a strip. And if you don't get enough blood, then it's an error code on your meter, and you're like, oh my gosh, I can't afford to test. Other times, some of my clients think it's a judgment. It's like, oh, I tried so hard and my number's 190. And they think it's a personal reflection on them, and it's never a personal reflection. That's something I really, really want to help you understand, that these numbers are just numbers, and they do help us as healthcare professionals help you improve your blood sugar control, because sometimes the numbers are high after the meal, sometimes they're high first thing in the morning, sometimes they're high before supper. So depending on when and where they're high actually determines what type of recommendations we're going to make. I had one gentleman who basically his numbers were high before supper, and we just had him do a walk in the afternoon and his blood sugars were great. So it's very, very individualized, but and I often have to negotiate with my clients as far as how often they should or be willing to test, because some definitely don't want to test, and I totally respect that. And I would say if your A1C is below 6.5 and you do have regular A1Cs checked, and it could be twice a year, so between 2 and 4 times a year, and they're under that number, I would say it's okay to continue doing what you're doing. I always like having people spot check, because I had one gentleman who had confusion. His doctor sent him to an endocrinologist who's a specialist in diabetes, and he was on one medication, and he sees the endocrinologist the second time and his numbers were good. It was an easily managed case of diabetes. Well, what this patient heard was, your numbers are good. So he stopped testing and he didn't go to his PCP, and his PCP thought he was seeing the endocrinologist. So what eventually happened was, 2-3 years later, he goes back to his PCP because he's not feeling well, and he had full-blown diabetes and needed to be on insulin right away. And he's like, well, I used to have it, then it went away, because he didn't understand the importance of testing. So,
No.
yeah. So, so sometimes I'll, if it's testing once a day, I'll say, how about if you test every other day but before and after the same meal, or once a day but vary it, because getting tests at different times of the day is helpful. And sometimes I have people that want to test 6 and 10 times a day, and they have pre-diabetes, and I'm like, no, stop. You don't have to do that. So
Right.
Some of my clients actually want to overtest, and it gets a little confusing and complicated, because the numbers aren't always predictable, because other things affect blood sugars besides what you eat. If you were stressed, I know if I go out for a run, my blood sugars are temporarily high. So I'm kind of curious what my number is going to be, because I am going to demonstrate a blood sugar test and how to do it today. But I did run this morning, and then I had oatmeal and blueberries, so I have no idea what my number is going to
Right,
be.
yes.
So
Well, we discussed that years ago, because I go to the gym every morning at 7 o'clock, and I do aerobic exercises and weights and stuff. And then when I come back home, my blood sugars were high.
yes, yep.
And so that's okay for it to be high
Yep.
then, but maybe in 2 hours and before lunch, they're down to where I would want them to be.
Exactly. And, I always see this in especially athletes, like high school athletes with type 1 diabetes in their sports. During their practice, they're more apt to run with low blood sugars. But during a game situation where there's more stress and adrenaline, and their blood sugars are high. And so it's not always black and white. But we're going to be talking much more about monitoring blood sugars at the next show. But today I would like to give a demonstration on how to test a blood sugar. If you're a bit squeamish at the sight of blood, you can feel free to look away, but I do encourage you to stay with me. It's really just a small, teeny drop of blood, and I promise I won't cry when we do this. So it's only going to be for a brief second. All right, so we're going to review blood sugar testing. So I have my materials. So the first thing you want to do is get your materials. So the materials would be your glucometer, a strip, your Lancet device, and your Lancet. I do recommend all 4. I've had clients not use their Lancet device and just kind of poke their finger with the Lancet. That's painful, so I'm just going to say don't do that, okay? So you get your materials all together, then you go and wash and dry your hands in ideally warm water. And you don't need alcohol swabs. I know at the hospital they use them, but they do take a long time to dry, and it could affect the results at home. So just wash and dry your hands in warm water. If you do have any issues trying to get blood to your fingers, a couple quick points is to put your hands down towards the ground and rub them together. So you want to have your fingers, focus towards the ground. And then afterwards, let's say I'm going to use my middle finger today. I usually use my non-dominant hand. I milk. This is milking the blood from the palm to the tip of the finger. So you want to do that right before you test. So I might do that one more time, but you can see it's red, and that means that there's blood flow towards the surface, so that's important. Okay, so I have my glucometer. The strip, all the strips are different. This strip, I call it a sippy end, where there's like a little tunnel, and that's where the blood goes in, and then the computer end. So you always want to put it face up into the slot, and in this one the slot is at the bottom, and when I put it in, it's going to turn on, and that's a good sign too that it turned on, and you can see that it's asking for a drop of blood. There's a little visual, ask for the drop of blood. I should have actually set this up ahead of time, because once you put that strip in there, you have 2 minutes before it turns off, and if that happens, you just take out the strip and reinsert it because it's not been used. So for the lancet, it fits in, you turn the little, there's a cap on most lancets, there's a small needle, I'm covering the needle. Most lancets device are adjustable. So this one has a number 2 right there, number 1, 2, 3, 4, 5, 6, 7, 8, 9. So 9 goes in the deepest. 9 is for the construction workers or the people with very, very thick, callous, dry skin. And I've had clients where they actually couldn't test their blood because the needle couldn't go deep enough. So most people can use between a 2 and a 4. I have mine on a 2. So this is the button I'm going to push. Again, I'm going to just rub my hands. I'm going to milk my finger, and I am just to double check to make sure that this is not going to turn off on me, because most systems you have 2 minutes once you put it in to do your testing. I'm just going to take it out and I'm going to put it in. And I did wash my hands before I came in, and I ate a bowl of oatmeal and blueberries and walnuts about 2 hours ago. So I am looking for a blood sugar under 140. Another trick I like to do is to fold the skin towards the side. You always want to test on the side of your finger because it hurts less. All right, so this is the warning. If you don't like blood, you need to look away now. I'm going to firmly put the lancet on the skin. I'm going to push the button, and nothing happened. How about that? I'm going to push it again. That I did feel. I'm going to gently squeeze, and believe it or not, that is not an adequate drop of blood. That's good to know. So if you saw that, you don't want to use that. So I'm glad that happened. I'm actually going to switch to this finger because no one has used this lancet. I'm going to reuse it. I'm going to again poke my finger. Oh, I'm going to adjust it. I'm going to put it deeper. I'm going to put it on a 4. So there we go. There is my drop of blood. I'm going to put the sippy end towards it, and it's just going to sip it up. And then you can see that it's reading. And in 5 seconds, we'll have a number, and 125. So my bowl of oatmeal and my blueberries is still being processed. It's under 140, and I had that about an hour and a half ago. So that is an acceptable number, and if I tested in another hour, I would expect it to be under 100. You can throw this strip away in the regular trash. Your lancet, however, needs to be put in a solid container. So what I do is I save the top, I just mush it in so that it's pre-capped. And then this needs to go into a container with solid sides and a top. It could be a bleach bottle, a laundry detergent bottle, a coffee can, anything with rigid sides and a top. And when you fill it up, you want to tape it up, write "do not recycle," and bring it to the local landfill, and they will take that. So that is an example of how to do blood sugar testing. All right, so hopefully you've learned a little bit on the proper way to test blood sugars. And in addition, some people with diabetes can use a system called a continuous glucose monitor to check their blood sugars. This is really helpful for those that have to test multiple times a day, especially persons with type 1 diabetes, or if you're a person with type 2 and you're on insulin and checking, 3 to 6 times a day. However, if the number is really too high or low in an unexpected range, I really do encourage you to check your blood sugar with a monitor. So with the continuous glucose monitor systems, what you have is a small cannula or a tiny sensor wire that's inserted just under the skin into the interstitial fluid, and it reads the glucose levels in the interstitial fluid. Sensors are generally good for about a week. They're taped on, they're waterproof, so you can shower with them. They're about the size of a quarter. And after a week they would need to be replaced. So Dexcom, Medtronic, and Freestyle Libre are the most common systems that are available. So if you're interested or think, insurance doesn't always cover them, so I think you do have to be on frequent blood sugar testing to be considered. But do talk to your healthcare provider if this is of interest to you. So that's the show today. I would like to thank Don for his participation and hope that you at home found this episode helpful. In our next show, we will have Don again and Michelle, and we're going to be talking about the benefits of monitoring, including that A1C, and helping you understand not only the best times to test, but how to use your results, because that's super important. So thank you so much for watching. And thank you, Don.
Thank you.